Hello, my name is Lindsay Rucker. I'm a student at SF State, and today I'm going to highlight the problem with mental health services while incarcerated when people get out upon release, and also propose some solution and ways to implement that. So, to start out by framing the problem, since the nation shut down a large amount of mental health facilities in the 60s and 70s for very good reason, because people weren't being treated well. There were a lot of unethical practices that were regularly occurring. Society did not, however, make up for that gap in treatment options. So our criminal justice system has become overwhelmed with inmates who have serious mental illness. And so criminal justice is being left with the responsibility of getting these people well, and they're falling short most of the time because that is not what they are trained for. You can understand the shift with some of the numbers I got from the article Decarceration of US Jails and Prisons. Where will persons with serious mental illness go? By Richard Lamb, MD, and Linda E. Weinberger, PhD. They said that before deinstitutionalization, which began in 1955, there were 559,000 people living in state mental hospitals, which was 339 per 1,000. And when this paper was written in 2014, they were beginning to try to release people from prison and jail because we had such a high incarceration rates in the US. There were 707 people locked up per 100,000. And out of about 2.2 million inmates, they said 350,000 of them are estimated to have serious mental illness. So many of them would be released and not have the support they need to reintegrate and live a healthy life. So if you look at these statistics, there were half as many people that were chronically living in psych hospitals. So I wouldn't be surprised if these rates were actually higher of people that were incarcerated with serious mental health challenges who maybe aren't even treating or confronting these issues because jail is not that type of environment. So they might just be in denial. And with the stigma and punishment that exists in criminal justice, it also may subject you to harsher sentencing and prolonged incarceration if you admit to having mental health problems. Also, I watched a YouTube called The Jail Prison System and Mental Health, a discussion on stigma and challenges faced. And there was a woman named Catherine Judd who worked in the Dallas County Jail mental health system, and she outlined the challenges very well. She said people with mental illness get unfair sentencing and may remain in jail longer than others that have done the same crime. They have behavioral health management trouble, so they might get isolated if they get in a fight because it's harder for them to function in the milieu. They get additional charges for fights they get in sometimes, which can lengthen their sentence. They have difficulty following the rules and are at a higher risk of being assaulted. And they also show, the statistics show that mentally ill inmates are more likely to complete suicide. She also said that under the Eighth Amendment, people are entitled to medical care, which anyone can tell you that's been incarcerated is a joke. Doctors are few and far between. There's a serious unwellness inside the walls. I actually have a real life example of someone that I met in Sonoma County Jail in the second level psych mod, which also goes to show you how they've had to adapt to this increase. They actually have 2 levels of psych that are both all gender accepting, which is actually much better than Marin County, surprisingly, because even though it's pretty crazy living in psych, it's better because everyone's going through the same rules. In Marin County, it's gender separate, so all of the female inmates live together and you just have different colors on. depending on your level. And so red is the most restricted. You only get 1 hour a day out or every other day. And it's usually at like 2 or 3 a.m. So you have to be really quiet and you get to watch everyone else getting out all day long. It was pretty depressing and lonely. And technically the other inmates aren't even allowed to talk to you. So um in Sonoma County, they have super psych mod, and if you're doing a little better psych, and it's pretty wild. But back to what I was saying, I met this guy in the super psych mod, and he really helped me out. I was going through some mental stuff, I mean, obviously, and he was a good friend to me. He was a lyricist from Vallejo, and we used to write a lot. And he was serving a 2-year sentence, but that was 9 years ago. So he's stuck in this loophole where they say he's just not mentally well enough to not reoffend. And he's in a psych prison in Coalinga right now. So he's just been taking all these meds and trying to get seen by different doctors to clear him. And then get this, he was actually prosecuted on hearsay. So they recently passed a law that hearsay is not sufficient evidence. So they're trying to get the case back to court to throw that out, and maybe he would be able to be released. But isn't that scary to just think you have no release date and it's just might never come for a 2-year sentence? Since he is in the psych prison, at least we get free phone calls, and I am still his friend and there for him. But prison and the psych ward are two totally different experiences. And I can say this because in my life, I never went to jail until I became homeless. Every time I got in trouble, I would go to the psych ward. And the other personal experience I have with mental health is while incarcerated, I witnessed that a large portion of the people were on psych meds, no matter which mod I was in, because I got into the recovery mod a couple of years into my probation when I had gotten a little better, and it was still at least like half the people that were getting meds. And it was kind of a struggle to actually get prescribed something. I don't know if they really had doctors to do analysis and prescribe, but I came in with what I was supposed to be taking, and it was crazy because they would do night meds at like 6 p.m. right after dinner and then let us out for rec at 7. So I had to cheek my meds, put them in your cheek and don't swallow it, so I could go run back to my cell and save it until after dinner, or I mean until after rec, because if I'm going to take my night meds that help with insomnia and they'll knock me out, then I'll miss my out time. And also, if you go to bed at like 7 p.m., then I would be up at like 2 or 3. So it was absolutely ludicrous the way that it was just not the way you're supposed to take meds. And sometimes I would actually save them, like if I wanted to trade for something, but that was rare. And the last example I'll give you is that one time I was in for 60 days and I was taking like the same amount of meds that I had been taking for like the past 5 years, or something like that. And sorry, it's like a little gory, but I was on my period for 2 months straight and I was pretty scared. I didn't know what was happening. I saw a doctor at least 2 or 3 times and they did nothing. It's pretty ridiculous when you go to the doctor sometimes. They're just like, whatever, go back to your cell, you're not dead, you know? And I didn't find out what was happening until after I got out and went to Kaiser a couple of times, and it was the psych med that I was on, lithium, and I had to stop immediately, wean off. So I had just been taking it the entire 6 months or 2 months, and it was causing me these problems. And then I also ended up triggering hypothyroidism. So now I get to take medicine for that every day. And the connection between homelessness, mental health, and incarceration is also important and needs to be part of the solution. And I think people get so mad when they see homeless people and they maybe don't recognize the system that we have set up that keeps these people in the death wheel. In the article Jail, Incarceration, Homelessness, and Mental Health, a national study by Greg A. Greenberg, PhD, and Robert A. Rosenheck, MD, they describe it succinctly by illustrating that homeless people and the incarcerated are more likely to be diagnosed with mental health problems, and that drug use is sometimes people trying to self-treat their conditions, and also, quote, people with severe mental illness may be less able to cope with the stresses of homelessness or may perpetuate criminal acts that are manifestations of their illness, unquote. It's not fair that as a society, we have laid it upon police and COs to deal with the consequences of letting severe mental health patients run amok on society. And I can say this because I was one of them, wreaking havoc, doing damage. And it was a struggle for me to get off the streets. I was having fun for like 6 months, and then it took me 3 years of going in and out of jail, looking for services, being on probation. It's not easy. In this paper, they also said when homeless individuals commit a crime, police may not be able to tell that mental illness was a precipitating factor. They're not trained like that, so it's understandable. They just treat like all criminals the same. Take them away and let the judge deal with it. Which I didn't really consider, but I guess judges also need to be trained in mental health. It's hard, if you don't have this training in your field to be dealing with people appropriately. So I did also find another article from a law journal library called Mental Health Court Judges as Dynamic Risk Managers, a new conceptualization of the role of judges by Shauhin Talesh, which was very captivating. I didn't conceive that actually whole new courts have been built since the influx of mental health patients in the incarceration system. This paper was written in 2007, and the data there more accurately reflects my experience. And in it, they said that, quote, as incarceration rates increased over the last 25 years, which would have made it since 1980, because it was done in 2005, these data sets, they said, over the last 25 years, the number of people with mental illness in the criminal justice system also steadily increased. By 2005, more than half of all prison and jail inmates had a mental health problem, including 705,600 inmates in state prisons, 78,800 in federal prisons, and 479,000 in local jails. These estimates represented 56% of all state prisoners, 45% of federal prisoners, and 64% of jail inmates. These numbers demonstrate why jails and prisons have been referred to as the new asylum, unquote. Now, can you imagine all these people being locked up with nothing more than a pill and more abuse? Incarceration is traumatic and can actually increase the severity of one's condition, and medicine is only a part of the solution. So therapy and behavior change needs to be in the equation, along with sleep and nutrition, which are hard to come by behind the walls. Even commissary food is a joke if you're lucky enough to have money. The nutritional content definitely leaves something to be desired. This paper also said that it, quote, in July 2006, the care provided to mentally ill prisoners was so inadequate that Federal District Court Judge Lawrence Carlton ordered California to hire more than 550 new mental health care staff. Similarly, a recent report in Oklahoma offered a disheartening view of the warehousing of the mentally ill in prisons. This quote about the Oklahoma prison, I think, paints a really good picture. They said, the most unstable inmates are housed in Fantasy Island, the nickname for the acute care unit. Surrounded by a 12-foot fence, it's a prison within a prison for 108. The walls, made of unbreakable glass, allow staff to see most of the unit at a glance. There is a 4-point restraint table where uncontrollable inmates can be tied down until they're calm. With temperatures in the teens one day earlier this year, few inmates ventured outside. Many milled around a recreation area in a zombie-like gait of the heavily medicated. Others, visibly agitated, paced back and forth and stared through the glass. Those considered too unpredictable and uncontrollable ever to be freed are locked behind thick doors with small windows. Screams, moans, and chanting are normal. The noise level rises as the sun goes down and before the medication kicks in. End quote. I'm sure in a psych incarceration, it is a special kind of hell to live and or work there, if you can imagine. Sometimes we forget about the other side and the toll it can actually take on people who staff these units too. It takes a special tenacity to survive in these settings. You almost have to harden in some ways, or you'll go down with the rest of them. Lastly, when describing the problem, I want to give you a quote from a mental health court judge. So there actually were special courts created to deal with mental health. And Stephen Marley of Santa Clara County said, I've worked with mental health clients for years, and I know our traditional method is to ignore them. We either cycle them through quickly or we give them long sentences. There's a stigma with the mentally ill that they are more dangerous, which is not true. Some are not. They are, however, far more difficult to work with. It makes absolutely no sense, in my view, to warehouse someone who is mentally ill and release them into a community with no services when we know they will be rearrested again and go right back to jail, end quote. So to get to the proposed solutions, we have to look at the whole problem. There are problems inside these jails and prisons, but if we want to slow down recidivism and the initial arrests, I think to prevent incarceration, if we have community service teams that deal with homeless people, providing resources and hooking people up with what is available to them, that is a big help. This is up to us as citizens to organize and make change a lot of the time, because if it doesn't benefit the stakeholders, it's left out of the conversation. A lot of us has been affected by these holes in services and left to fight for ourselves swimming upstream, or we see people close to us suffer and we can't save them ourselves. So the policies need to be changed, especially for people suffering with mental health challenges, so they don't get stuck in the loop of drug abuse, homelessness, incarceration, and ultimately societal rejection. I have divided my proposal into 6 categories: community activism, police education, government involvement and policy change, improved services for the incarcerated, nutritional and behavioral whole person care while inside, and education for judges and legal professionals. And I will go into each of these and how they can be implemented. So to start, the community activism piece is a powerful component when dealing with mental health and incarceration, especially when it comes to street teams and people that can build relationships and provide hope for people dealing with mental health and homelessness. Sometimes it takes being able to talk to someone who's been through similar struggles and has found a different way of life to be able to imagine it is possible for them too. Doing this project motivated me to reach out to the street crisis response team of San Francisco to maybe do my senior internship there. And they said they didn't have any volunteer opportunities, but that someone from public health would reach out to me. So that's exciting. What they do is respond to crisis calls to prevent police contact and de-escalate disruptions in the community. They bring a paramedic, an EMT, and a peer support. And after that, I also talked to a friend of mine who works on a team in Oakland, and he said currently they were like driving around and mapping encampments in West, North, and East Oakland so they can perform, like, they can plan their outreach days or like set up a table in a certain area where there's a lot of foot traffic. And that it's all about building relationships with these people and handing out your card so they know they have someone to reach out to when they want help accessing services. So this is not an overnight matter. He said they also have a street team in Oakland called Macro, so I sent them an email. Then I wondered if we had one in Marin, so I tried to contact them, but it's a little hard to get through to some of these services because it seems like they always need more staff, you know? So part of the solution could also be to divert more funding to community programs like these so that they can have the appropriate amount of staff that they need to do the job they're trying to do. It seems like wherever I look in social service, they're always struggling to have enough people to run the business. So these teams can help with preventing police contact as well as upon release, connecting people with mental services or recovery meetings. I know that we have recovery coaches in Marin, and if you get assigned one, that they can help make sure you stay sober and like provide support in that way. And it's also about building relationships with other teams and funders, people in government to make sure that like we're filling the holes in these services. And what's hard for someone, especially if you've been incarcerated before, is building relationships with law enforcement. But in many cases, I'm sure that the law enforcement are thankful for other professionals intervening because the police don't necessarily know how to deal with it, and they're sick of the revolving door too. They're sick of seeing like the same people, you know, over and over and bringing them to jail and nothing changing. Um, there are other reintegration services that are needed, such as like help finding a job or housing that is vital to anyone's mental health, regardless of their diagnosis. And these teams can help with that as well, so to prevent recidivism. Secondly, police education and policy reform are important things to improve upon. As a society, we need to demand mandatory training for police officers, including de-escalation techniques and recognizing signs of mental illness. Also, maybe to like implement some humility and the allowance of police to call on mental health teams assistance instead of just more officers, which can accelerate mistakes and unnecessary violence from officers, especially surrounding BIPOC incidents. There are countless victims of unnecessary gunfire when it comes to police dealing with mental health calls. It's scary. So let's just try to remove them from that equation. And also advocacy for policy reform, because sometimes it takes it being written down for these actions to be implemented. So it's not just a common sense suggestion, but an actual law that can be enforced upon the enforcers. Third, I'd like to talk about government involvement and policy change. The way that city and county governments can contribute is to set up and provide these resources that we are so desperately trying to hook these people up with on the streets with our community outreach teams. Alameda County Probation actually has a Motel 6 that they converted for people getting out of jail to stay for 6 months. So you can do 6 months at the six to get back on your feet. We need lots of these in every county. We need people to have a chance to actually, do the right thing. And advocacy with local and state legislators to advocate for increased funding and staffing for mental health services inside, and policy regarding reintegration too. We're setting people up to fall back into homelessness and crime with no aftercare. So improving on probation services and the organizations they are linked with, I think would also be helpful. We all need to be communicating to get someone stable after jail and addiction. It's a team effort. Governmental staff could also have public awareness campaigns about mental health to reduce stigma and raise awareness for the need for treatment. And they could also gather research data showing cost effectiveness and societal benefits of mental health treatment over incarceration. Number 4 on my solution list would be to enhance services for incarcerated individuals. And with education comes freedom. If people were able to be accurately diagnosed and empowered with tools to treat their condition, it could create actual healing and sometimes even a desire to help others. At Folsom State Prison, when they started the drug counselor cohort of people working on themselves and training to be counselors, it created some of the strongest workers that we have in the field. And better believe they didn't reoffend. Addiction is a disease and it could be considered a mental health condition. So if we are to give people a chance to make something of themselves, give value to their life and their sobriety, and a chance to help others avoid prison, that's all we want to do, is never go back and keep everyone else out too. So preparing someone for release could help them not just do the same thing that they're used to doing to survive, because that's how we developed these habits to begin with. We felt like we had no other choice, or it seemed that way at least. To get someone set up also upon release, like to see a doctor and make sure that they have the meds if they need them, a place to crash, maybe some work. These are vital things that need to be covered before someone can even think of staying sober. And collaborating with local healthcare providers can also make a difference for them to come in and treat inmates if the jail is unable to hire. 5th on the list is that this goes with the improving services, but I think it also deserves its own category. What people don't realize in America sometimes is that what you eat definitely affects your mental buoyancy. So nutrition needs to be improved as well as behavioral health education. If you are not eating well, it can be hard to regulate your emotions, which is already a challenge with some diagnosis. So it's just compounding the problem. Also, stress tolerance can be affected with bad nutrition, and being locked up is very stressful. Having to be hyper aware, it is never quiet. It's a nightmare, no relaxation happening. So their food is something that could help to these humans behave better. And as I think I said earlier, even commissary food is not very helpful. You can get like ramen and tuna, no actual fresh food. Lastly, in my list of solutions is educating judges and legal professionals. The police don't know what to do, and they think the judge will figure it out. But as the judge said earlier, they just disregard these people and throw them to the wolves. That was coming from a judge who worked in mental health court. So regular courtrooms are even more unruly. In one of my charges, the felony that got me like the probation that got me sober and stuff, I think I was so unwell that I got charged like outside of court. I didn't even go to court. I was like in a mental, I was in a psych ward. And that's how far gone I was. They would bring me to court in a wheelchair and I didn't even have to wait. I was like in and out, throwing up West Sides, laughing at everyone. So if lawyers and judges could also have some mandatory training on how to deal with these kinds of cases, it has become such a common occurrence that we need to have policies in place of options for sentencing. But it gets scary, like in my friend's case, where they just say, you're never going to get better. You don't get out. Or you're not apt to go to trial, or you're too crazy for court. I don't know why they never said that to me. I don't know if they have mandatory continued training for legal professionals, but they do in alcohol and drug counseling. So that would make sense if they do. And so making sure it is part of that continued education to be able to keep your licensure, I think would be helpful. And advocacy for the development of these specialized courts that focus on rehabilitation too, instead of incarceration. But it would be helpful in that case if they had places to go recover, like a treatment center where professional counselors can help them instead of just another psych jail. So in closing, I'd just like to say this is an extremely dire situation that we've gotten ourselves into as a country, especially when people come to visit San Francisco. They're warned about the homelessness and drug addiction rampant in the streets. These services need to be connected in communication and working together to pick up where the other left off, because if you miss one step or one date, it can all fall apart when you're so close to getting off the streets. We need case management, whole person care, and the imagination for the space for someone to grow and live in a society where people actually care for the well-being of others and not just their belongings, status, and property values. This is the world that I will fight to make a reality, and why I feel called to work in the Bay Area in social service. I have really enjoyed this class. Shout out Tick from Cherry Hill. I hope to continue my education so that I can be of impact to the solution and maybe prevent unnecessary years of suffering for my fellow savages just out here trying to live. Thank you so much for listening.